every topics we are setting that science and everything is on the basis of evidence based practices, means all the practices are based of evidence. So nursing research provides this evidence by systematically investigating the problems related to the health, related to the illness or the nursing care, including the education, administration, and all about the community health. So, what happened in the traditional area? The nursing care was often guided by the custom, what were the experience from the old side, all the trial and errors methods, everything we are including in we includes in the traditionally. But however, with the advancement of the science and technology, nursing has evolved into a research-oriented professions. That is, the nursing research enables nurses to question exactly what the problem is and how we are going to practice, how we are going to evaluate, and how all the practice comes in the effectiveness of the nursing intervention. So to develop all the new knowledge and to improve all the patient's outcomes and the quality care, we need to go for the nursing researches. So as simple, I can say that nursing research involves asking the important questions, collecting the data using the scientific method, analyzing the findings, and applying the results on the nursing practices. And yes, it is really playing a very crucial role in promoting the evidence-based practices. So nursing research is a systematic and scientific process of inquiry that generate evidence to improve nursing practice, education, and administration. So yes, this is the nursing research. What is the meaning exactly? It's a one-to-one words. See, in nursing research focus on the patient care, and it is a systematic and scientific logical process. We can say it is used to discover the new knowledge, verify the existing facts, and solve all the related problem with the help by the nurses. Yes. The first thing is, what is the concept behind this nursing research? So the concept behind the nursing research refers to all the scientific, systematic, and the critical investigation of the problem related nursing practices, education, administration in the healthcare system. What is that? With the purpose of generating new knowledge or validating existing knowledge to improve the nursing care and the patient's outcome. We talk about the more detail in the concepts. So nursing research is a systematically study of the health and health promotion and the patient care to develop the trustworthy evidence that guides nursing practices. See, now in these days, whenever we are talking to any patient about the disease condition, they know more than us. Every time if you ask what antibiotic you are giving, they will give you any number of name for the antibiotics. Painkillers, they know more painkillers name than us. So like this, the patient is well known about the disease conditions. Okay, so here when we are going for the practice, we are giving the care, we need to put everything on the evidence base. So what is it is going to be focused on enriching the individual ability to respond to the health challenges, developing the interventions, and understanding the full lifespan of the health and complementing the biomedical researches. Yes. So, at the core of this nursing research is all about the asking relevant clinical and professional questions. What are the problems exactly going on, and how we can solve on the basis of evidence? So, collecting the data with the all scientific manners, we will learn in the upcoming webinars that how to collect the data, how to find out the question will be the next webinar. Just after me, Dr. Porter will take care how you have to find out the best question and how to formulate a statement on that base. So everything will be going by one by one. Yes, so these are these definitions. These are all in the books. So nursing research develops knowledge about the health, illness cares, and nursing responses across the lifespan. And we can say it focuses on the promotion of the health, prevention of the disease, treatment, and rehabilitations. Okay, so nursing research now places strong emphasis on the evidence-based practices. Yes, so these are all the definitions. Now we have to see what are the key elements of concept of nursing research. The first one is systematic process. Every time, every means we have talked, we are always using. this must be systematic way, it must be in systematic practice, it must be systematic in the administration. What exactly the systematic means? So yes, we need to follow step by step scientific methods. I mean, one by one, we cannot jump up to directly to the 24th step. We have to go 1, 2, 3, 4, 5, 6, 7, and like that we are reaching up to the floor of the 24. So yes, we have to go with the step by step. It includes all the problem. We need to identify, we need to collect the data, we have then the collection of the data. After that we have to go to analyze, then we have to interpret this, then the results will come in. Okay, so this is the scientific process we need to follow. Then scientific and objectives. What is that scientific and objective? That must be logical, reasoning must be there, that must be empirical and evidenced. Okay, minimizes all the biases, that must be subjectively. So this is very much important, how you are putting your objective for the particular problem which you are going to be supposed to for your research, for the evidence-based research. Okay, then the problem oriented. Yes, we need to be focused on the real issues. Just sitting in a room and finding this is the problem, that can be the problem, on this we are going to be do research, on this topic is very much interesting, so many researchers are there, I'm also going on the same research. That is not, that is a goran dod, you know, every person is running behind the research. Exactly, we need to focus on the issues in the patient care, what exactly is happening, why this issue is coming again and again. Then we can find, we can go with the evidence researches. Okay, in the nursing education, administration, and the community health, you are seeing in the nursing administration, the techniques are changing. Okay, and the practices also, all the techniques, everything is changing. Every day the new technology is coming. So that is all. The when the new technology is coming, new issues are coming. So we cannot based on the previous researches or traditional researches. We have to find out the new issues, the new things. That is the research. Okay. Then the next one is knowledge generation. It produces new nursing knowledge. Yes. What I learned in my basics educations, now it is not here. My in my time only one or two books are available. Now n number, every second person is author. Okay, so like this, new things are coming. We have to produce new knowledge. Okay, new nursing knowledge. We need to test and refine the existing theories and practices. What happened means, before 80 and 19 or 60 or 50 and 40 years ago, one theory was written. That theory was based on that particular problem. Maybe that now the problem is resolved, so we need to be upgrade that theory also. Okay, so that means we need to add the new knowledge. New knowledge is always important to add in your research, because then it will be again the copy paste. So we have to go with the knowledge generation. Then again I'm coming back to the evidence based. What is that? We need to form the foundation of the evidence based nursing practices. Why it is there, where you have seen. Okay, what is going to be happen after this, what can be the result. So everything is there related with the evidence in somehow. And the most and very much important point is ethical in nature. I never heard ethical when I was studying. Now the ethics are so much is there, copyrights, patency. You took my this title, or little bit also you cannot copy from there. The case will be there for the copy. You have means copyrights, everything is copyrights. Yes, here whenever you are going for the for any research, we need to go with the ethical in nature. We are not supposed to harm to anyone, we are not supposed to copy anyone's materials. Yes, so here also the one webinar will be there for the ethics. Now about the scope and concept. So here when we talk about the scopes and concepts, the promotion of health, prevention of illness, care of the sick and disabled. ये आप लोग you heard many times promotion of health. And what is that the proportion of health? So nursing research contributes significantly to health promotion by identify the effective strategies to enhance the physical, mental, and social well-being. And the research help to the nurses to design and implement and evaluate health education programs related with the what the problem is coming, or that can be related with the nutrition, that can be related with the exercise, that can be related with the mental health, and all the lifestyle modification, maternal and child health, anywhere we are supposed to go for the promotion of health. The next one is prevention of illness. Everyone knows these the core words we are understanding. What is this prevention of health? First, we need to promote in all the aspects. Then we need to prevent from the illnesses in the area where the disease prevention takes place. That can the researchers are going to be focused on identifying the risk factors that or the early warning signs of any illness. Okay, then for that we are going to take the preventive measure for the both, whether it is a communicable disease, either it is a non-communicable disease. So researchers finds and guide us the what are the immunization practices are supposed to be there, are added or deleted, and according to the need and the screening of the program. Then it's come to the infection control programs and measure. And so many companions you are seeing the every time the government is taking so many of the programs, awareness program, awareness campaign, and our students, nursing students, every health day we are taking on rally, we are going for the health education, we are going for the skate, we are going to road mapping, so many things. What are that? These are all the awareness companions. So preventive nursing research plays a very important role in reducing the disease burden, the complications, and the healthcare cost also. So yes, prevention of illness is a scope for the researchers, and it is comes in the concept also. The next one is care of the sick and disabled. What is that care of the sick and disabled? So first we promote the health, that we need to be healthy. If in case there is a illness, we are going to prevent that illness. And if 1 or 2 or 10% the people gets ill or the sick or the disabled, then what are nursing researchers, how they are improving? So yes, nursing research improve the care of the sick and disabled by evaluating an effective nursing intervention for means any chronic illness. These researchers help to develop the evidence-based clinical protocol for the pain management, you can say, for the wound care, for any medication administration power, any patient safety, a long-term care, wherever it is needed. The researchers are helping a lot. So it is also sometimes addresses the special need for the persons with the disability. So what is there? The promoting the independence, care, dignity, the quality of life. So this help the nursing researchers help in the care of the sick and disabled also. The next point is rehabilitation and palliative care. Shashank sir, I am audible or a single time I am talking from it? In between, I will ask I am audible or not.
Yes, ma'am, audible.
So the next one is rehabilitation and palliative care. It is now so much in practice. Palliative care, lots of special courses on this palliative care, special nurse is there, and there also super specialty is coming. Palliative care in which field? Is a massage or other size or where it is? Sometimes in the children, sometimes anywhere. So I'm seeing there are many special courses came in the nursing on base of this palliative care. What is that? So in the rehabilitation, the nursing researchers support strategies that helps the patient regain the maximum functioning ability after the any type of illness, any type of injury, any type of surgery. So yes, this research also strengthen the palliative care by identifying the best practices and the evidence-based practices in their pain relief, in their symptomatic treatment and the management, sometime in the psychological support, sometime it is going up to the end of the life care also. So yes, this evidence-based palliative care nursing ensure the comfort, the dignity, and the holistic care for the nursing. So yes, here also I can say the this nursing research is important. The next one is improvement of nursing intervention. So yeah, by seeing all 1 or 2 or 3 or 4 aspects, we can say that is a key scope where the nurses are continue with their intervention and improvement in their interventions. Okay, so they examine the existing practices, compare with the previous and the current one, and they are introducing the new techniques. Okay, so what is that? They take some innovations, innovative intervention. They enhances the effectiveness in their safety programs. They lead to the development of the standardized nursing practices at the clinic with the clinical guidance, and the best practice protocols come on the basis of evidence. So yes, it is going to be improve the nursing intervention. If I talk about the evaluation of nursing outcome, so when the things are based on the current issues, current techniques, updated knowledge, updated care, so yes, when the evaluation comes, it will be also good. So nursing research plays a very crucial role in evaluating the nursing outcomes, such as patient satisfaction, recovery rate, complications rates, quality of life. So these things also sometimes, if you will go through with some researches, you will see there are some based, some are promotional health promotion based, some are prevention based, some are care based, some are rehabilitation based, some are evaluative researches. So there also the nursing researchers are helpful, yes. And policy making formulation, lots of researches are there. So here they are going to help in the health policy formation, nursing standards, I can say, regulatory guidance, research, mean quality improvements are there. So in these all the formats, the nursing researches are very much helpful. Okay. The next one is characteristics of a good research. Systematic. I already explained about what the word means, the systematic and the logical. So here, as a characteristics of a nursing research, the nursing research follows a planned and organized sequence of steps, such as identify the problem, reviewing the literatures, collecting the data, analyzing that the result, then evaluation, then the draw the conclusion, what the exactly comes at the end. Yes, this all the round figure that is going a systematic approach ensure the accuracy and reliability of the findings. Yes, then the logic, everyone understand what is logic. So research is based on the logical reasoning and scientific thinking. What is that? Each step is linked with the next. What's supposed to do? Such as I found out a problem, then the objectives. This is the problem. What exactly I want to do? That is the objective. And it's come in our mind. It will be benefited or non-benefited. To whom it will be benefited? Yes, that comes in hypothesis. Like that, then who will be the sample? Okay, then the sampling techniques, how I will collect the sample. Okay, then how I will get the sample, then how I will collect the data collection came, then what data came going to be find out the research, and then okay, this is the reason why this issues is occurring. So like this, everything based on the logic. Then this empirical is always data based. So here the nursing research is what relies on the means observation, measurable, means verifiable data. Okay, where you can say it is 2 number, 3 number, 200, 2 lakh, 2 crores, million, trillion, whatever. Okay, so that data will come. So collecting through the observation, interviews, questionnaire, or any type of experiments, this empirical data we can get. The next one is relevant to the practice. Okay, when okay, replicable is a good research study that can be repeated by the other researchers. For example, I have seen that we cannot go what other researchers already done, but yes, if anything is left over in any research and you think that that can be more better, that can be more precise, that can be more means repels, so then you can go for the again, you can repeat that research. That research is not replicable. Then next one is objectives. Objectives means the nursing research is conducted is an unbiased and natural manner. Okay, so where the researcher avoid all the personal belief, all the emotions, all the personal thoughts, anything that oh result will be this, and the research is not yet started, but you have in mind the result will be this. That not be there. That totally focused on the unbiased and neutral manner research, that is objective. Then the relevant and the practice education and policy, then here in the nursing research that addresses the real problem in the clinical practice, in the administration, in the education, in the health policies, in the community areas, anywhere, what exactly the problem is there, and the findings, whatever the research are supposed to do on that issues, that must improve the patient care if it is a clinical, that must improve the teaching strategies if it is the education, it must improve the decision making if it is in the policy. So yes, whatever we are going to do, that must be benefited. I have seen many of my students and other students when for the examinations, I'm saying that they are only doing the simple research, copy paste, taking from here and there. Exactly, the student don't know what is the purpose of research. We are not here completing the copy paste system. We are solving the issues, and that must be related with a particular department where your research is going to be helpful. So whenever I am being examiner somewhere, I always ask how your research is going to be helpful and to whom it is going to be helpful is very important. So yes, that must be relevant. The next one is ethical driven and evidence based. Whatever the research you are doing is guided by the ethical principles based on the evidence based practices. Huh? And that related with the all the means you are supposed to not do not harm to anyone, do not copy from anyone, do not take the things from anyone. That is there in the ethics, and ethics are very much important now in these days. But I'm seeing there are very less ethical centers are there, departments are there. It is only written in the paper. Ethical permission has been taken from so and so. All the maximum times I'm seeing that. Okay, if I talk about the integrate theory and practices, so yes, nursing research have to develop the test and refine the nursing theories, and those nursing theories are going to be applied in clinical situation. Wherever I get time, then me and my some of my friends, we have developed theories nearby that are already researched, practices already. So if I will get time, definitely once we will present those theory also. Those are all the refined theory, updated theory, and we can say that that can be practiced in the new researches. Okay, why nursing research is important? Oh, very important. Why nursing? Yeah, nurses are also asking, students are asking to us the basic means our uh, graduation students are saying why the nursing research is needed. Our post basic students saying हमको research क्यों करना है? Why we have to go for the nursing research? Why we need this nursing research? As a like this they are asking हमें क्यों करना है? Why we need? So yes, you need, my dear students. I already explained in my previous slide why the nursing research are needed, how we are going to helpful in the healthcare system. We are the oxygen of this healthcare system. We are the is whole soul in charge. You can say you can download all the departments of healthcare system if you are not working well. So yes, we are the important part, and we need to do these nursing researches to provide scientific basis of nursing practices, because when you yourself will go through the problem, you will find out the problem, we will find out the objective behind that, you will work on that, and the result will come. Then you will understand, oh my god, my research result is this much helpful in the healthcare center. Yes, so that's why these all the nursing researches are very very much important. So what is that? The first one, they provide scientific basis for the nursing practices. So nursing researchers, they are continuously replacing the traditional routine or other experience based practices. As we are saying हमारे जमाने में ऐसा होता था, but that experience we are saying, but not about the research. We are saying हमारे जमाने में research होता ही नहीं था इतना. Now the research is too much. Now our eyes are open. Now we are so much of knowledgeable. The things are many things are changed, so all based on scientifically tested on the knowledge. So yes, the nursing researchers, they ensure that the nursing interventions are all based on the research evidence. They are making the nursing care more rational, more systematic, and very very effective. That's why the nursing research are important. It is definitely going to improve the quality of the patient care and safety. By this we are going with the best and safest practices on the evidence based. With the for the patient's care, we are also going to help to reduce the error in the researches. We can prevent the complication. If I say, sometimes you are saying you have your own idea. If you are going for any IV line also, you are saying, oh, no, holding like this, you are putting like this, a finger like this. So you have your own idea how smoothly you can put the cannula. So like this, like all the aspects, when it comes in your practice, you know this is the black's practice. You know the then you know the evidence that somehow my senior or my teacher, someone shows like that, we can go with the comfortably putting the cannula. That is tested. That means if you are same, you are treating to your juniors or your colleagues, or you are telling or you are explaining to someone, so maybe you can say it is evidenced by me before that if you are going with this way, the cannula will not be much painful or one time shot will be there. So yes, when the problems will solve on the scientific based with the tested knowledge, definitely the errors are supposed to come. They come slow, the complication will be reduced. That's why it is going to be improve the nursing care. Okay. And it is also enhance the overall quality of the care of the adopting proven intervention and standardized protocols. It is also going to facilitate the evidence-based practices. When you will put your research outcome, you know that if the things are going wrong, lots of complications will come. Then you can go through with the evidence-based practices. And when the research will come, they are going to support decision making in the policies, I already said. And yes, definitely it will help to the nurses to evaluate the new technology methods. Many technologies are coming. Before that, when we are putting cannula, someone we are calling, "Aao bhai, haath pakad lo." Now there are so many things are there, you can go through with this. The next one is guide health policies. Yes, already discussed, the researchers are definitely going to help for the development of the health policies. They will these all the researchers will improve the nursing standards, providing the good guidelines in the field of educational research, curriculum development, innovation, teaching methods, clinical practice, competency based training, anywhere these are going to be guide us. And yes, when all the things will come, that's means everything from first to the guided health policies, at the last it is going to enhance the professional growth. Nursing research promote the critical thinking, problem solving approach, and lifelong learning to all the nurses. Then how it will be helpful, it increase the professional accountability by encouraging nurses to justify the action based evidence and contribute to the recognizing to the nursing independent respected profession. That's why at the end I will say these nursing research are important. Okay, the nursing process. Yes, the nursing process is complete all the chapters. Okay, where we are going to identify the problem, a question. That means the we can say what exactly the problem is there. Now, problem statement. Okay. Then the review of literature, selecting the design, sampling, data collection, data analysis, conclusions. Everything will be taken in every webinar. I request every student to be continue with this all the webinars. Then only you will understand how you are getting the all the detail regarding how to formulate the questions. Just after me, the tomorrow, Dr. Navina JH will take how to go through with the review of literatures. Then Dr. Kunur will say what are the types. Okay, like this, how to data collection is there. Then what are the method how to publish everything means all the things will be detailed. So here types. Okay. So research are based on the by approach, by purpose, and special types. So first I will see the by approach. In the detail, this quantitative, qualitative will be taken care by the Kunur sir. So yes, when we talk about the quantitative research, means by approach, you know you are going to count the number. You are going to count the quality, see the quality, and you are going to mix, means you are going to count the number also, and you are going to see the quality also. That is the mixed method research. So here, if I talk about the quantitative research, is this is the systematic investigation that always focus on the numerical data to measure the variables and extreme relationship between the using statistical methods. So what are the special features in that? Always this quantitative research is the numerical data or the statics based. Structured and standardized approach is taking variables are all clear, defined and measurables. Data collection tools are fixed, objectives are fixed. So always here when we talk about the quantitative, how we are going to be collect the data. So you can use the questionnaire method, you can go with the rating scale, you can go the observation checklist, you can go the psychological measurement like this. Any things which can be measures, okay. And major quantitative designs are experimental research, quasi experimental research, correlation relational research and descriptive, that will be taken care by the Kunur sir on the third day, that will be here very soon. The next, oh sorry, the next one is qualitative research. When we talk about the quality, that means everything is measurable, the quality. Okay, so quality research focus on the understanding. Sometimes what are the experience you are having, human experiences, their perceptions, their beliefs, the meanings related to the healthcare or the nursing care like this. What exactly in their features? All the words that may be narratives, descriptive rather than the numbers. So by the name only you can understand quantitative, the numerical, qualitative, the quality, the perceptions, the experience, how it is going to be fake. Then flexible and unstructured, semi-structured approach will be there. Because it is on the emotions. This is all about the belief. This is all about the perceptions. So that can be semi-structured approach, and emphasizes always on the depth, richness of the data will be there. So you cannot say 200 samples we have taken. It's very tough to take the collection of the data from all the emotions from 200 peoples. Very tough. If it is there, it will take many years to do the qualitative research. Okay. So yes, when it is quantitative research, always sample size can be big. But in the qualitative research, sample size is always limited as per the topic, as per the issues, as per the question, as per the problem statement. Okay. What can be the common data collection method when we talk about the qualitative? So here can be in-depth interview. आपने कैसा feel किया? How was that? How it was going through? Means very deep interview, not a direct question. What is your name? Not like this. Okay, focus on the group discussion. Participate with the observation, and lots of field notes are also important. So, if I talk about the major designs in the qualitative research, phenomenology, grounded theories is there, ethnography can be there, case studies can be there. So, like this, we are going with the qualitative research. Yes, if it is about the mixed method research, they combined both quantitative and qualitative. So here the both things will be their approaches in the single study. Their number will be there and the quality will be there. Okay. So it is always integrated with the numerical data and narrative data. Hmm? Allows the findings to be triangulations. Enhance the validity and depth results will be there. So what type of researches come in the mixed method? Sequential explanatory, qualitative and quantitative both. So here the quantitative will move towards the qualitative if it is sequential explanatory. Okay. So first we'll go through with the quantitative, then after that we'll go with the qualitative. Okay. Sequential explanatory also say sometimes qualitative to quantitative. So from here to there and there to here both. And concurrent triangulations also comes in the mixed method research. I must say this time many seminars, so many conferences are focused with the mixed method research. I so here by purpose we have basic types of research, that is pure, applied research and the action research. Basic research is also known as a pure or the fundamental research. What is that? Is conducted to develop a new knowledge, a concept of a theory. That is basic pure. Simply by the name you can say this is pure, this is my own. This is my own generation. This is my own idea. This is my own explanation. This is my own emotions. So whatever you have feel, you have founded, you have grounded, that is comes in the basics and the pure research. What are the characteristics of this basic research? They are always theory oriented. They are always conducted under the control condition that this much is a limited. Is we cannot cross this area. That is here. The results may not be immediate practical when used. Sometimes it will take a long time to be formed out, because when you will say this is my own idea, it will take very much time to believe on you till it is not going to be proved. So yes, it is taking immediately. It cannot comes in the practical use. Always it will take time, and it is also formed to the applied things. Means you can say the foundation for the applied nurses. Your knowledge can be there for the applied. The next one is applied research. So, as the word says, it is conducted to solve the specific and practical problem that always encounter with education, administration, and health policies. Applied researchers have very straightforward purposes. They are always here to improve the care and outcome of the patient care. They are always able to give us the evaluate the nursing intervention, their techniques, and the programs. Always provide us the evidence-based policies, formulating the clinical guidelines. So whatever from the beginning, I'm telling that everything comes in the applied research. So we can say the characteristic of this applied research are the practice oriented, conducted in real clinical and community settings, result oriented, and immediate application can be there, and you can say directly improve the quality of the patient. So like this, we can go with the applied. If I talk about the actions researches, so action means not like the shooting someone like immediately. So action researchers are always participatory or the problem solving research approaches. And these are very much specific practice in the specific practice setting and immediate improve the research in the progress, such as we can go with the something cyclical in nature, plan, act, observe, and reflect. Like this aspect they are doing. So you have to plan, you have to act, you have to observe, and you have to reflect immediately. So it is always conducted in the actual work environment, focus on the improvement and changes, and always so much of reflective, collaborative. So we can say when the word come action research, it is always means easy to go fast and do it fast like this complete. The next one is special type of current. My slide is visible, sir. Special types. I'm not able
Yes,
to.
ma'am. Current use.
Current use is there. C section is there. Yeah.
Yes, ma'am.
Before. Yes. Yes. Night is special type of current use. So outcome researchers are there and systematic researchers are there. Many times the senior students must have heard about the meta-analysis. Okay, so when it is comes with the outcome researches, that means the type of applied, the outcome is there. Means we know that something will come out. Okay, so it's focus on the evaluating the effectiveness, benefits, and result of the nursing care and the healthcare intervention with the patient's outcome. So always these type of research they focus on the patients after nursing care is delivered. Means you can say that feedback style. Okay, whether the intervention are truly improve status, safety, quality life, everything comes in the outcome. So uh, sometimes the examiner asks if your research is there research is the outcome based research. That is also important to see what type of research is there, outcome research. So it measures the I can say patient recovery rates and length of the hospital stay, sometime complication or any type of infection, pain reduction or the symptoms control, and also functional status, patient satisfaction status, and then practice oriented patient centered care was there or not, where it is conducted, real clinical settings or any man-made like this, using what type of research was there, qualitative or quantitative or the mixed method. So these everything comes on the outcome research. If I talk about the meta-analysis and systematic review, it is a structured, comprehensively synthesis on the existing research studies, means whatever is already there. So yes, why we are using when the research is there? It is just to predefine the method of minimizing the bias. So that's why we are saying the meta-analysis goes one step further by the statically combine the results of the multiple quantitative studies. So, what is the purpose? Why we are going with the meta-analysis? It is going to be provide the high level of reliable evidence. Okay, so big deal means जो details researches and these are all always the meta-analysis. Okay, then key features what are there? Define the research question. In comprehensive literatures research are there. Critical appraisals may be there, and use a statistical techniques to pool data. Okay, increase the sample size and the power. So these all comes in the systematic review and the meta-analysis. So I can say these special researches in the core researches are very much important for the nursing also. Yes, here is the evidence-based things, means evidence-based practices that ensure the nursing care is the current, we can say the scientifically justified, patient-centered and outcome-oriented care always, rather than based on the traditions. We are going with the routine practices. We are going with the scientific-based practices. We are going with the best practices. So, in the best current research evidences, I can say it derived from the high-quality nursing researches. What include in that? Experimental studies are include, outcome researches are include, systematic reviews are include. So these three types of things are included. Researchers are included always in the current research evidences. If we talk about the provide, what is exactly we are getting from these researchers, scientific justification of the nursing interventions. Okay, we ensure that the care based on what works best for us, not the assumption that ये ऐसे हो जाएगा. We know that this is going to be workout. That is best current research evidence is there. If we are going with the clinical expertise, it is going to be based on the nurse's knowledge, their skill, their judgment, their past clinical experiences. Okay, so when the nurses are having good knowledge, best skill performances, they have a good judgmental criteria, the skills, and the very good past exposure in the clinical setting, so they can interpret it easily. They can find the problem. They can apply their own knowledge, appropriate knowledge in the real clinical situation, and that is definitely going to support the individual in context of the specific care in the nursing field. If you talk about the patient's values and preparations, yes, the preferences are there. Constant patient beliefs will culture, it will comes. Every day we are seeing the changing things are there. Beliefs, we are penetrating the beliefs of the others, and we are finding, yes, this is true. By showing the evidence, they are believing, they start believing on us. The culture is now going to be changed. The expectations are more, the needs are more, the choices are very, very much. So yes, when the researches will come, the new technologies will come, patients value and their preferences will definitely work out. The belief will be definitely work out for us. So, if I talk about the application of the nursing research, simply we can say it works in the clinical practice, as my last slide says that everything is repeating again. The same thing is there. Evidence-based protocols are there. Quality improvement is there. Outcome evaluation will be there. If it is in the clinical practice, if it is educational, so yes, definitely it is going to have the curriculum design. It is going to have the techniques and methods of evaluations. Okay, if it is the field of administration, the staff models will come, the staff satisfaction will come, the teamwork will be increased, the preventive strategies will be coming. Okay, if it is in the community and public health setting, then we can say the lots of program development will come, lots of preventive strategies will come. And if it is about the informative and technology, big data analysis we can do with the researchers. We can go with the good clinical decision support. We can go with the standardized terminologies, clinical care, classification, nursing data. Like this, we can go with the new technologies. Yes, ethical consideration. We must know that we have to take the informed consent. We need to tell them that the confidentiality, the privacy, we need to maintain. What can be the risk for the sample and for the you, that you must know. Means that is also is there. Participant protections, they must be safe, sound, they feel sound, they feel free when they are participating with you, so their consent is important. Okay, the review of institutional board, IRB, ethics committee, whatever is fit in your own research criteria, you can go with the there. And the very very important point is the respect for the autonomy, cultural values, the person himself or herself is very very much important. Yes, I will sum up that understanding the basics of nursing research concepts, their types, their applications will definitely help for all the nursing professionals to find out the new issues, to find out the way how to deal with them, and definitely they are going to be help out in the clinical setting with the good clinical practice, evidence-based clinical practice, and the education side. It is going to be support with the new strategies in the teaching criteria, teaching strategies, and if it is in administration, the things will be solved. The supportive, the peer group, the faculties with the good administrative techniques. And yes, definitely the point is to be give a best care, evidence based care with the help of the nursing researchers. It is like same, we are going to build up the evidence, we generate the knowledge, guide this. So thank you so much for being an amazing listener, all the students, participants, delegates, faculties, and my dear listener from outside the country. Thank you so much. So I request Shashank, please find out whether sir is there and we can directly connect with him because the time is, I think, nearly free. Oh, I am on time. Thank you. I'm audible. Yes.
Yes, ma'am.
So I, you just connect with sir.
Yes, ma'am. Just minute. I just uh,
You
text
just
him. Yes,
yeah.
ma'am.
Okay. So my I was not having a particular topic to where I have to get so much of things to talk to you on the delegates. It was just an introduction about the research, that what is nursing research and how why it is important to do and what can be the types. And yes, what is the concept behind doing so many nursing research and where we are lacking in the field of evidence-based nursing researches. So I hope I just clear your one or two point that what exactly the nursing research is, because it is going to be helpful in your next session. That is how to find out the good question, how to find out the problem, and what can be the objectives for those problems, how we can go with the hypothesis settings, how we can go through with the research. Students, they are sitting in the hall, and sometimes when we are telling about the first chapter, second chapter, then they are saying समझ में नहीं आ रहा है इसलिए समझ में नहीं आ रहा है because we are not going everything step by step, we want to jump. uh, Many times I am seeing the peoples are going with the directly with the review of literature, and they are still not knowing which topic they are going to do for this nursing research. Are they chosen the topic for the research? So yes, it is important to go systematically. The again the very important word, systematically, one by one.
Yes, ma'am. Sir has joined.
Okay, get it start. Sir is here. Sir, good afternoon, good evening from your side.
Yes,
Thank you, thank you so much for accepting our invitations all away from your Malaysia sites. You are here with us. I just introduced the topic and we are waiting for you. So I will request to Sakshi to introduce sir.
So, moving ahead, it is my pleasure to introduce our second speaker for today. That is Professor Dr. Sandeep Poddar sir. Sir is currently serving as Deputy Vice Chancellor, Research and Innovation at Lincoln University College, Malaysia, with additional responsibility as Executive Editor Publications. Sir has been serving as Member Board of Studies, Lincoln University College, contributing to academic governance and curriculum advancement. Sir holds distinguished academic qualifications, including BSc Honours in Zoology, MSc in Zoology, PhD in Zoology, Diploma in Dietetics, and MPA from Lincoln University College, Malaysia. Sir brings over 2 decades of international academic research and administrative experience spanning India, Malaysia, and Southeast Asia. And Sir has previously served in progressive leadership roles at Lincoln University College, including Associate Professor, Senior Researcher Director, Director of Operations, and Acting Deputy Vice Chancellor, Administration. And the topic for today's second session is From Idea to Impact, formulating research problems, objectives, and hypotheses in research. We are delighted to have you with us today, sir, and we look forward to learning from your expertise. I now invite sir to begin the session.
Thank you, and very good afternoon to all of you, and also Madam Deepti Madam for inviting me. And I just share my slide. Is it okay, visible?
Yes, ma'am. It is visible.
Okay.
Yes, sir.
Thank you. Thank you. So today we are here for the international webinar From Inquiry to Impact and Advancing Research Excellence for Evidence-Based Practice. And we have seen that, I have seen the brochure that many other research aspects also will be discussed in these 2 days conference, means the webinar. And many physical participants also there I can see in the hall. So all of you are here to, means we are here to share some experience, as all of you are studying, so all of you have already some knowledge about the how to process, what is the research problem, what is hypothesis, and how to reference guide everything on what is going to be discussed in this conference. But it is a refreshment, and also we share our views on this aspect. So when we are today, I am discussing on the my topic is formulating research problem, objective and hypothesis in nursing. So I am discussing on general aspect, and then we will come up that how nursing aspect can be coordinate, means interrelated with these aspects. As Einstein told that doing the same thing over and over again, expecting different results. So that is the research. We do the same thing, but we get different result always. And for this, doing the research is a process, and that process need inspiration, then idea generation and implementation. So if we want to implement something, we should generate an idea first, and that idea, how we generate that, I told you to jump from the somebody that jumped from the roof, that person will not jump. That inspiration of jumping he should have. Then I inspire somebody to jump from the top of the diving and swimming pool, that maybe he or she take the inspiration that okay, I shall jump on the swimming pool. But of course, he will not jump from the roof to die. So that is the inspiration, idea and implementation, and that should be implemented. So that there should be 3 things which in the research and every aspect of our life also we should maintain, that desirability, that we desire or not. Just 1 minute. And then if we have desire, then we have viability and feasibility, that viability and feasibility, that yes, it is feasible or not. A research topic we are thinking that is not feasible, then it cannot be conducted. So we have to think about the viable topic and viable outcome, and we should have a desire to get the result. So all these three should be balanced, and then only we can get a result. Is it okay, my voice and everything?
Yes, sir, very well.
Okay, thank you. So at first, before we generate a topic, and we should know what is hypothesis. Always we know in the book and everything where we always study that hypothesis is there. And we, in a research paper also, we see that there is H1, H2, H3, like there H5 hypothesis, 5 hypothesis is there. So what is this hypothesis? Hypothesis is a pre-assumptive statement. Okay. And that is a provisional in nature, and hypothesis should be clear, concise, structured around the relationship between variables. So if we have to plan a research, we should have a hypothesis. Not only research, in every aspect we plan a hypothesis. We should discuss, like a plant is growing, that is a hypothesis, and there will be variables that will support the hypothesis. Suppose the sunlight is the variable. If there is no sunlight, plant will not grow, and if there is no water, plant will dry. So a plant growth also depends on the variables, and that variables will give a hypothesis that plant will grow, and there will be another hypothesis, plant will die. The same thing, this is a provisional in nature, that plant will grow or not grow. Even if there is no sunlight, it can grow in a what you call electricity provided light. So that is a provisional, and the hypothesis should be clear, concise, and structured around the relationship between variables. Okay. So what is the purpose? As the explanation of relationship between the variables can be tested, it furnishes the proof of research that has enough background knowledge, direction of investigation, that how we can proceed and how we can achieve the result. So there should be a direction, and that hypothesis will drag to the objective of the research. It is structured, that it is not the unstructured matter that vague or false. It should be a powerful tool in the research process to achieve the dependable knowledge. So when we want to get a result, the hypothesis must be strong and should follow the objective of the research. So that is, nature is clear statement, what to be investigated. It should identify the research objective, first one, and identify the key abstract concept involved in the nature, and also the relationship between problem statement and the literature review. So when there is a not the hypothesis not clear, then, and also it is vague, it cannot be visible, then the scientific research cannot be conducted. Clear? So now, what is the nature? Again, it can be tested. That I fix a hypothesis that cannot be tested. Suppose I am telling the plant is growing, so there is it can be tested. I can measure the height of the plant, so it can be tested. But if we tell that the plant, what we call inside something happening, or maybe it cannot be tested. Maybe I can tell the plant is what you call demotivated. Okay, mental health of the plant is not well. That cannot be measured, because the mental health of human can be measured by psychometric tested, but for plant I cannot measure, even it is a living thing. So it is not a proper hypothesis. So the mental health of plant cannot be measured, but mental health of patient can be measured. So it can be tested, and there should be a moral and ethical question. Means not be a moral or ethical question, and neither too specific or not too general, and prediction of consequences, and considered valuable even in proven false. Now, if we do, suppose an example I'm giving, during COVID, infection, COVID-19, we used to have anti-malarial drug given to the COVID treatment. It is highly circulated that time, but one test found that the anti-malarial drug have cardiac issues during COVID treatment. So we cannot use that medicine for the COVID treatment. So that is, even we have a proper hypothesis that the anti-malarial drug will will cure the will prevent the COVID-19 attack, but it becomes proven false that it cannot be used. But it is a valuable option and it gives a valuable data that it has a impact on COVID-19 and also have a cardiac issues in relation. So comorbid factors are initiated. So this is a valuable finding and outcome in the research. Okay. Now, when we do telling that review of literature, etc., we should have, how should we have a good hypothesis first? So it should be a total elucidating power, acceptable explanation, must be verifiable, that I told that it can be measured or experimentally proved, formulated in simple understandable terms, corresponded to existing knowledge, testable considering the current knowledge, realistic, clear and unambiguous terms, states the expected relationship between variables, and it should be limited in scope. Okay. Now, main thing, how to source, how I can plan a research. Before we do a research, we should do a review of literature and discussion with the expert to give the problem an objective. Then we have a prediction that what I'm going to do, what should be the result. And then we can give a previous experiments or done or not, that studies also give a support to the hypothesis. Now, suppose I'm giving an example of cooking at home. During preparation of cooking at home, at the morning, suppose in the home kitchen, we have to cook. Then we have to think, suppose in the patient diet in nursing home or hospital, when we are preparing a food, the dietitian have to know that, okay, which food to be given to a diabetic patient, which food given to a renal affected patient and a normal patient or a cardiac patient. So different types of food she has prescribed. On basis of that, we have to find the resources in the kitchen, that what type of vegetables available, if it is vegetarian or non-vegetarian, if the patient is taking beef, chicken or fish, we have to all eliminate the things. Then only we can find a proper resources for our research, and that objective is to feed a patient with diabetes, suppose with renal function and diabetic. So now with hypertension with diabetic patient, I am planning a Kepner's diet, suppose. Maybe you don't know, Kepner diet is a rice based with fruit. Now that is cannot be diabetic patient food. That is for renal function and hypertensive patient. But if we give that Kepner's diet to a diabetic patient, it may raise the sugar level. Now, for that reason, we have to firmly think that which diet should be given to which patient. Accordingly, we should have a review of literature, that the knowledge, and we should discuss with how the patients will take the food. If he want the semi-solid food, he want a broth, or he want a liquid food. Accordingly, we have to make the hypothesis that yes, the patient will take broth, the patient will take liquid diet or semi-solid diet or solid diet. Accordingly, or suppose simply we can tell the patient will take Western diet or Indian food. Then the researcher will make a good hypothesis that, okay, I shall prepare 50 Indian diet, 2 Western food, 1 North Indian food, 5 West Indian food, like that. So then only my hypothesis is clear, and this will come from the review of literature of the questions we have asked to the patient, the survey, that yes, what is your diet, what you want to take the preference, and then we have to consult the doctor's suggestion, dietitian suggestion, then only we can prepare a test or means the diet prescribed. So this is also a research hypothesis. And when suppose you when we are working as a nursing or healthcare professional, you can always do a research on the diet and the patient health conditions. And many patients come with different comorbid factors, like just now I told, diabetes with renal failure or diabetes with hypertension. Then how you can give a diabetic means without salt food and also restricted in sugar, that you have to calculate. And that hypothesis you have to prepare, and how many patients coming, how many patients going, accordingly you can formulate a research idea. So this is a hypothesis how we can develop. So main thing is we have to have a solid question that what diet you want to take. Second is background research. Third is making sure it is testable. Yes, this diet can be taken or not, and that diet will be supporting the diabetic or means to prevent the diabetes or not, to prevent the renal failure or not, and then independent and dependent variable will be there. What are the independent dependent variables in cooking? Suppose I don't have chicken source in my kitchen. I don't have a proper means one vegetable which is the choice for the patient, that is not available. So that are the variables, and that we have to think that which other variable can be covered that thing. Now, when we are talking about independent variable, it is a cause variable, cause. This is the cause, which is explanatory variable or predictor variable. Simple 3 line you can understand that when we're doing a experiment, there should be a cause factor, and I shall describe later on better. Independent variable is what? That is a criteria variable, that effect variable, or outcome. What is the response variable? Means I am telling that a plant is growing. That is dependent variable. What is the independent variable? Sunlight. If sunlight is there, plant will go faster. So that is the independent variable, sunlight. Dependent variable is plant growth. Same way, suppose I am giving a health experience, health related, so that you can understand easily. Suppose oral cancer. The risk factors are the dependent variable. What are the independent variable? It may be poor hygiene, it may be UV exposure, it may be cigarette smoking, tobacco use, alcohol use, or genetic predisposition factor, malignant oral disorders, many things. These are all independent variable, but all is related to oral cancer. So if the independent variable is not triggering, maybe oral cancer will not develop. So if the independent variable is not there, dependent variable will not grow. Clear? And as well as you can see that there is an outcome is the oral cancer, and the cause is the independent variables. And independent variables are not dependent on each other. They are all separate. Maybe it can be comorbid, means two independent variables can play together, but it is always, it means usually it is separate. And when we do research, if we consider more independent variable, our research will be complicated. And of course, nowadays, when we submit any article or something and we do any research, we have to have many parameters we have to keep in mind, and we have to plan accordingly. So like this test also, oral risk factor, I have taken this picture from a journal. So you can see that person, researcher, have making so many independent variables taken in consideration. So all this measurement data he or she has to collect. Maybe he or she had to collect from 500 patient data to check the oral cancer. And you may add different. When there is a genetic predisposition factor, you can go inside the genetic and you can check the ethnic originality of that person. Is it Western food taking or Indian food taking? If he taking mutton oriented food or non-mutton oriented food, suppose in colon cancer like that. So if it consuming more on meat-based diet like the Western countries, and Asian countries, they more on take on rice-based diet. So the genetic disposing factor will be more in case of colon cancer. So like that, many cofactors and many other independent variable you can work on. We can work on. Even also tobacco use, you may use cigarette, you may use chewing tobacco or different types of khoini or something. Different types of tobacco use can be done for oral cancer. So when we planning, we should have main dependent variable we have to plan properly to what is the get the result, then independent variable. Okay. Now we have to keep in mind that without independent, there is no dependent variable. Whom to depend if there is no independent? If there is no sunlight, if there is no day, there is no night. So night is dependent on day and day is dependent on night. So this is the vice versa. So we have to play on this. Now, suppose in a just giving a lighter example that the teacher is instructor telling that you have broken what you have broken. Then the person telling that I have not broken it. It may be other cause. It may fall down for other thing, or it may automatically fall down for air or something. But the instructor is telling that you are the only one here, and I am sticking my original hypothesis that you have broken this utensil. But it may happen due to other factors. It may happen for rat or something. It may not be for that person's responsibility that that thing is broken. So that is the hypothesis, and there is a null hypothesis that it is not broken by that person. So there is a, we call it null hypothesis, that nothing. So no difference between groups or no relationship between variables. That is the null hypothesis. It is the main hypothesis we calculate. And what is the alternate hypothesis? That which can expect the data to show. Okay, that is the research-based topic. And then we have to prove that this alternate hypothesis is right or the null hypothesis is right. And when we do experiment, it may prove that alternate hypothesis failed and null hypothesis is remain. Or it may prove that alternate hypothesis is remain the same, means remain, and null hypothesis is nullified. So this is the test types of hypotheses, and we are following this. And alternate hypothesis, as I told you, that you can take many variables and alternate hypothesis will be many. Like smoking of tobacco will rise oral cancer. Alternate hypothesis 1. Chewing of tobacco will give more effect on oral cancer. Alternate hypothesis 2. So accordingly, we can make different hypotheses. But if we make many hypotheses, it will cause a problem in the research for outcome. Because objective, as I told, the hypothesis should be concise. We cannot take many hypotheses. We have to concise the hypothesis to get a firm result on this. Okay. And already when we know that tobacco is a comorbid factor or means variable for oral cancer, we should not consider that, we should not give more impact on that. Okay. Now, it is a, as I told, that it is a, what you call it, relative factor, that it, the means hypothesis I grew or I shrink. Okay. My cloth is getting short, we are always telling, but cloth is not getting short. we are always getting more bigger and bigger, so our clothes become shorter. So the hypothesis is wrongly stated that clothes become short. Okay, that is the error. We can tell there is type 1 error and type 2 error. When null hypothesis is true, but the test decision is to reject the null hypothesis, this is type 1 error. Maybe it will be complicated for all who is not, means if we don't have statistical classes before, so we should not go further, I think. Just type 2 is conducting the null hypothesis to correct when it is fact is not. And suppose type 1 error, I have just given a simple example that type 1 error is rejecting the null hypothesis when it is actually 2. So a male patient cannot be pregnant. So null hypothesis is rejected when we are telling that you are pregnant. Same type 2, that it is true that a female will be pregnant, but I am taking a wrong error that you are not pregnant. So that is the type 2 error. So these errors are there and we have to plan accordingly. Type 1, type 2 errors in the hypothesis testing and when we're doing the results. Okay. And these errors we are finding with the different types of statistical analysis, we make it out. Okay. Now, importance is the main importance is to provide the direction of the research, the outcome. Okay. So that we can get a conclusion. Sure. Or other thing you don't have to know. We have to know a firm result and firm direction our hypothesis will give. Now, I am giving an example how to think. I think until now, I think if you have any question, you can ask, or I just continue that hypothesis is, I already told that what is the result outcome we have to think. And accordingly, you have to plan a experiment. Now, how to generate an idea of research? Suppose this accident happened. Always we see in the newspaper that bus or car is accident and patient have taken, some patient died. This is normal news, so we just overlook. But as a healthcare professional, when we see, then we see that the car is always happen. Now we have to think that what are the things that happen for the accident in behind when you do research. Suppose it may be a mechanical fault, and that mechanical fault may be for the bus or maybe for the car, maybe in the brake system or maybe in the tire. So there are different types of mechanical fault and each hypothesis we can plan around. Same thing, when we are nursing research, healthcare provider, we can think it is psychological problem of the driver and the driver of bus or the car. Now, what is the psychological problem? The driver is overworked, stressed in the bus, maybe over duty, so he cannot sleep, so he become fatigued. Or the car driver is drunk, so he make accident. Or the car driver is falling asleep because driving long time, no change of the driver, human resource problem. So the psychological stress is there, so it is problem. This is one side of bus accident. But if you think about the patient side, who is injured, what is the health psychological condition on that? So the patient is transported to hospital or healthcare center where we are giving treatment. That time the patient party, another person is standing beside. One patient, broken hand, so I am giving treatment. Same bus, another patient was traveling, he or she is standing beside and we don't know that he or she has internal hemorrhage. And he is more psychologically stressed because the cost and what to do, etc., etc. There are many things are there. Okay. So this is the psychological trouble, and also when we are working, suppose one nurse as a worker, I have to work 24 hours for this accident. I have to do over duty because I cannot leave and we cannot go out when the patient means come in a large scale. So I cannot change my duty. I am psychologically stressed. So not psychological stress not only for the bus driver, it is for the patient. It can be for the health workers as well. So there are different types of research aspect may come out for this accident in a psychological way. And of course, human resource also same that I cannot change. So how many persons should be there? Doctor is there or not? Means the carrier is there or not? Ambulance is there or not? Hospital administration also there. We have enough facility. We have extra facility also and etc. Medicine, everything is available or not? Administration is supporting or not? So there are different types of research question we can generate. And finally, suppose an example of hypothesis that it happens in the hilly area of Himalaya. So the bunks are there at the bend, the accident always happening. So the HP have put out an automated honking system by AI technology that when the car is coming, it will automatically honk and the car driver will be alerted. So that accident can be what you call predict means prevented. As the driver is alerted, the collision can be avoided. So this is a simple example of research and outcome. Okay. And also the idea generation. Is it clear? And of course, when we do this research, etc., we should do sampling. I am not discussing here. I think my time already over. And in other time we can discuss. Maybe other person may share sampling and what are the how to do sampling, different types of sampling, target population, certified sampling, etc. Now, as I told that hypothesis should be statistically proved when we do. So we have a confidence interval and always we know the probability that 95% chance the people will die, 95% chance the people will survive. So it is means when we have cancer, we may think that okay, 95% chance is the patient will die after 6 months or after 1 year, 2 years like that. So there is a confidence interval. And of course, based on that, the p-value and significance we calculate. Okay. And of course, the statistical, we have research question as hypothesis, parameters, dependent and independent variables. Of course, selected the appropriate sampling method, collect the sample data, and appropriate inferential methods that yes, this is the result. Okay. So interpret the result and communicate the finding. Then with the significance. Okay. So hypothesis, null hypothesis versus the hypothesis, alternate hypothesis. Which one is true? That is our issue, and we have to create the hypothesis, and based on the hypothesis, we have to come to a conclusion, and we have to determine the p-value and the significance of the p-value. Then only we can get the result. Okay. So statistical significance when we do, why? Because we have to make a cutoff point that yes, 95% chance. Now it cannot be more. Now, suppose I give you an example that patient is going to birth a child when the father or mother is carrier. Now simple, forget about patient. I am telling that I am giving a toss, simple toss. So now there are how many chance of putting head or tail? we can tell 50-50. As Johann Mendel told, 3:1 or 1:2:1 ratio, we can tell 50-50 chance of boy or girl. But how many child is giving birth? One. So one child, there is a chance of 100% become boy or 100% become girl. There is no 50-50 chance. If there is two also, 100, 50-50. Means two at a time, that twin baby, that also may be chance of two boys, two girls, or 50-50 chance is not there. 100% chance is two boy or two girl. Or maybe it is twin, maybe that time, sometimes maybe 50-50. Okay, but if we try this thing for 1,000 times, so the probability will tell 550 is boy, 450 girl, or 550 girl, 450 boys. Now, if we do 10,000, then the chance will be 5,500 will be boy, 4,500 will be girl, or 5,500 will be girl, 4,500 will be boys. So the chance of probability is getting more and more. So then we can come up with the Mendel's hypothesis 3:1, or we can tell 50-50 chance of head and tail, like that. Okay. So the chance and probability is depending on the sample size. For this reason, when we do formulated testing or research idea, we must get a bigger number of sample size so that we can get a proper result outcome. Clear? And of course, when we do the nursing research, nowadays, we should focus on AI technology and etc. Like this technology-based app developed by nursing researchers, and it will measure the room temperature, room humidity, everything, and very easily. And it is marketed and used by the nursing staff with collaboration with the computer science. Suppose RoboVR during COVID-19, we already heard. So that's also outcome of nursing. I cannot go to the patient, so I am placing a robot to assist the nurses. The RoboVR is, robot is assisting, AI robot assisting to the young babies at home where we cannot go always. The nursing staff is not enough supporting. So we have to plan how we can give a support to a patient from the far. Same as robotic surgery, and of course the drone, RoboVR, or the drone technology can taking elderly care, or the pharmaceutics aspects, or at the ward level, everywhere the robotic is coming, and that is controlled by AI technology. And so these are the things where we can think new things, and that research idea should generate from all of you that which one is feasible in your place. You are working in a village and you thinking about RoboVR, it cannot be possible, may not be. So you have to plan which is feasible at your place where is no electricity, no light, etc. Then how you can make feasible the care at your place. So that is the challenge, and that is the novel idea you have to develop at your place. Like this, a drone can go and treat a patient quickly to help show a video, and that how can give CPR training to a other person, the fellow member, and they can give a support, immediate support to a patient. So that type of drone technology may be used in where there is no what we call electricity, etc. That you can coordinate with other urban places and make a drone technology, something like that. So it is not that what you plan, up to you. That should be feasible and cost effective. And there are many gadgets, always we use smartwatch, etc. So that now already we move from the thermometer to digital, and now when we are passing by a computer, already the temperature is monitored. So the patient coming to your place, you don't have to do a thermometer test. Maybe it can already scanning the temperature of the body. And of course, there are physical touch, and when the nurses are the first person when the patient coming in the clinic. So you can see the nursing student of our Lincoln College sitting during the COVID vaccine time in the front. They are the frontliner, and we have to face the patient at the first time, not that doctor and other person will face. Any problem happen also, nurses should be taking care, and they cannot be jump on the patient and patient party may jump on the nurses, that yes, why the treatment is delayed, why patient accident happening, blood coming out, you not taking care. So all these things the nurses have to handle from the front as a frontliner. And of course there are different types of what we call outcome, like this is the copyright form from the Indonesia and myself done by the nurses. And so there you can apply for copyright, you can apply for patent of your work, and you can publish your article, the research idea. Like this book chapter is present in Scopa's book chapter, or Spinjar, etc. There are many articles you can publish in our Malaysian Journal of Nursing. It also is Scopas Index Journal in our university. So there are different types of ways and avenues where you can put your research output. So idea generation, hypothesis testing, sampling, research, then you have to proof it, means you have to publish it. Otherwise, nobody knows. You do something, you don't publish, that is not an use, nothing, no use. So you have to publish or publicize it. You may put in Facebook, you may put in social media so that everybody know. Suppose the COVID vaccine is affecting, the antimalarial drug is affected the patient during COVID-19. If that work is not published in newspaper or social media, we still may be using the same thing and dying. So it is immediately spread the news by social media, and we stop taking the antimalarial drug during COVID. So publication is most important in research, and that is for publication you need proper hypothesis, proper research design, sampling, outcome, and then publicize. So with this, we were all working with United Nations Sustainable Development Goal and also the Viksit Bharat by 2040 and this one 2030. So goal number 1 is no poverty. Goal number 2, zero hunger. Goal number 3, where we are working good health and well-being. And of course, we are in quality education, goal number 4. Now you think that if we don't have food, we don't have work and money, so how we can think about good health? And we don't have good health, we don't have money, don't have food, etc. Then how we can go for education? So, and when we don't have education, how we can provide good health support? So all these goals are interlinked with each other. If we are not educated, we cannot generate business, we cannot eradicate poverty. So all these goals are interlinked, and we are all working together the partnership for the goal. And for this partnership, goal number 17, we are here and discussing. And thank you again to Madam Dipti and all the organizers of this conference and all the participants, of course, of the Samarpan Institute of Nursing and other places, to giving me the opportunity from Lincoln College, Malaysia. Thank you, Madam. And thank you all.
Thank you so much, sir. Is there any questions from the audience?
Any question?
Everything was very much clear with the basis of practical and all that. I don't think.
Okay, if any question, you can feel free to contact later on also with me. No problem, madam. You can share my contact detail.
Yes, yes. Thank you so much, sir. Dr. Sandeep Podar, sir, Deputy Vice Chancellor, Research and Innovation. Sir, we really so much of blessed to have you here, and our sincere gratitude and heartfelt thanks to you for conducting such an insightful and enriching webinar. The topic was research problem, objective, and hypothesis with evidence-based practices, and your session was so much clear. It was totally based on conceptual understanding, practical guidance, strong linkage between the research formulation along with the evidence based, and whatever work you had did with the faculty members and the students alike associated with all the topics, all the material was there. So your expertise clearly, it was a best and clear explanation with the real world examples. I have seen so many pictures you have put. It's fantastic, eye catchings, made the sessions highly engaging and academic and very much impactful, sir. Thank you so much. And
Thank
we
you.
wish you to have you in our further webinars and physically in the upcoming international conference in December. I will try to have you here. Definitely, I know that you will be here with us. So thank you so much, sir, once again on behalf of Samarpan Institute and Delawi University, Philippines. She is collaborated with us today. The students are there in a group. So thank you so much, sir, for sharing such a knowledge, all the inspiring evidence-based nursing research, publication evidence, and the most important point, which is still blinking in my mind, that you said why the publications are important. Yes, as
Yes.
you given a very good example of the vaccination, one means injectable. So really, whatever we are doing, we need to take it in the public. Then the people can understand. Okay, these complications can be there, that infections can be there. These can be the consequences. So it is a very good and great example that to tell everyone that why these publications are really important. As such, people are saying that we are running behind the publications, the number of publications. So today you clear my mind for that, that it is not about the publication and number of the publication, whether it is the Scopus or PubMed or whatever. It is there to inform them this is going on and you are not supposed to do the same. So is a best way to provide the information, the research oriented things and the results of exactly the problems and the issues which are done by the evidence based practices in the research. So thank you so much, sir. It was eye opening sessions, I must say, and as throughout I was following your session, it was fully engaging and highly academic. Thank you so much, sir, once again.
Thank you, madam.
And thank
And
you, sir.
of course, I should add, as publication also important, and also patent and copyright also important, because it is
Yes, sir.
my work. So when I do the work, I should take the initiative that it is my work, I should protect it. So
Good.
that also should be there. And as soon as suppose I discover something, I should publish it quickly. It may not be, I am not Pele, so maybe not Q1 rank. I am also football player. So it may be also a different journal, but we should publish and we should make copyright and also patent the idea so that it can be used in future to the benefits of the society or community.
Thank you,
Thank
sir.
you all again, and thank you, madam.
So that means we can have sometimes another webinar on the patents and copyrights.
Sure, madam.
We'll catch you again.
Thank you.
Thank you so much. Thank you so much, all the participants, all the faculties, academicians, research scholars, and from different part and outside the countries. Thank you so much for the part being the part of this wonderful international webinar series. Today is the first day. We hope you will get come back tomorrow on the same time. I can say the same channel, that is the Zoom with the Samarpan. Thank you so much. Take care, sir. Good night,
Thank
sir.
you.
There is the, I think, more than 6:30. I think how much it
6:30.
is? 6:30. Thank you so much. Sir.
Thank
Thank
you.
you.